Aplastic anemia is a rare but serious condition where the bone marrow, which produces blood cells, stops making enough new blood cells. This leads to a shortage of red blood cells, white blood cells, and platelets, which can cause a range of health problems. Red blood cells carry oxygen throughout the body, white blood cells fight infections, and platelets help with blood clotting. When all these cells are in low supply, it can lead to fatigue, infections, and excessive bleeding. Aplastic anemia can develop suddenly or gradually, and it can affect anyone, but it's most often diagnosed in young adults or older people. The exact cause of aplastic anemia is sometimes unknown, but in many cases, it's linked to damage to the bone marrow, which can be caused by factors like autoimmune diseases, viral infections, exposure to toxic chemicals or radiation, certain medications, or even genetic disorders. In some cases, no clear cause is identified, and it's referred to as idiopathic aplastic anemia. Autoimmune conditions like lupus or rheumatoid arthritis can cause the immune system to mistakenly attack the bone marrow. Other common causes include viral infections like hepatitis, Epstein-Barr virus, and HIV, as well as prolonged exposure to toxic chemicals like benzene or certain drugs, especially chemotherapy or antibiotics. Symptoms of aplastic anemia vary depending on how low the blood cell counts are. People with aplastic anemia often feel very tired and weak due to a lack of red blood cells, which can lead to anemia. Other common symptoms include pale or yellowish skin, frequent infections or fevers from low white blood cell counts, and easy bruising or prolonged bleeding from cuts or nosebleeds due to a lack of platelets. In severe cases, there can be unexplained bleeding, such as heavy menstrual periods or internal bleeding. Some people might also experience dizziness or shortness of breath. Diagnosis is typically made through blood tests that reveal low levels of red blood cells, white blood cells, and platelets. A bone marrow biopsy is often performed to confirm the diagnosis, where a sample of bone marrow is taken to examine how many healthy cells are present. In some cases, doctors may look for possible underlying causes, such as infections or autoimmune disorders, through additional testing. Treatment for aplastic anemia depends on the severity of the condition and the underlying cause, if known. In mild cases, treatment may involve medications to boost blood cell production, such as growth factors or steroids. In more severe cases, a bone marrow transplant might be necessary, which involves replacing the damaged bone marrow with healthy marrow from a donor. This is often the most effective treatment for younger patients. Another option for severe cases is immunosuppressive therapy, where medications are used to suppress the immune system, preventing it from attacking the bone marrow. Blood transfusions may also be necessary to help manage symptoms, providing extra red blood cells, white blood cells, and platelets. For people with aplastic anemia, it's essential to manage their overall health carefully. Preventing infections through proper hygiene and avoiding people who are sick is crucial, as low white blood cell counts make it harder for the body to fight off illnesses. Monitoring for signs of bleeding or bruising and seeking immediate medical attention if these occur is also important. Because aplastic anemia can be a life-threatening condition, it's vital to follow the treatment plan closely and have regular checkups with a healthcare provider. While there is no one-size-fits-all approach to treatment, advances in medicine have significantly improved the outlook for people with aplastic anemia, and many can go on to live healthy lives with proper care.